Hello, everyone. I'm Joan Devine, Director of Education with Pioneer Network, and I'd like to welcome you to today's webinar, part of the 2020 Sharing the Vision series, Long-Term Care Equality Index, Introducing Best Practices that Strengthen LGBTQ Inclusive Communities. Just a few housekeeping things before we start. Including in the materials you should have received, you will find a copy of the slides in both presentation and handout view, a list of resources that Dan and Sherrill have provided, and a certificate of completion. A few other things just to mention that all webinar attendees except for the presenters are muted just to minimize the possibility of background noise. But that said, we do want to hear from you. So we encourage you to use the chat box and the Q&A that are located in your toolbox, and also to go ahead and raise your hand if you would like to join into the conversation live. And now that said, I'll be monitoring that for Dan and Sherrill. So they'll be answering a lot of questions at the end, but certainly if there's things that we need to address in the midst of the webinar, we certainly will look at that. About 24 hours from now, you'll get a link to the webinar recording, and it's also going to be placed on the Pioneer Network website resource library under video resources, so that will be available to anyone, whether they have registered or not. So that said, I'm pleased to introduce our guides for today's conversation, Dan Stewart and Sherrill Wayland. Take it away. You're muted. Whoops. You're both muted. Okay, let's see.
Thank you so much, Joan. Hi, everyone. My name is Sherrill Wayland, and I am the Director of National Education Initiatives with SAGE. And I'm really excited to be here today, and just want to thank the Pioneer Network for inviting us here, and happy to present with Dan.
Hello all, this is Dan Stewart. My pronouns are he, him, his, and I am the Associate Director of the Aging Equality Project, and repeat similar aspects that Sherrill just stated. We are very excited to be able to present on this information. Thank you all for attending, and thank you to the Pioneer Network for hosting us today.
Before we get started, Dan and I really just wanted to take an opportunity to thank you. And on behalf of SAGE, I want to extend my heartfelt gratitude to the work you all are doing to support not only LGBT residents, but also all residents who call your communities home during this pandemic. I have many LGBT friends, as well as LGBT friends who are caregivers, as well as residents, who, I've seen firsthand the support that's being provided to them and their families as residents in long-term care. We honor you and your teams for your dedication and all the work that you are showing during this challenging time.
And on behalf of the Human Rights Campaign Foundation, truly want to thank you all that are working on the front lines during this global crisis. Whether working directly with residents, patients, clients, or ensuring the day-to-day operations run as smoothly as possible. We thank you for your continued dedication and commitment to ensuring that we make it through this precarious time together. Truly, whether at home, whether in a community or anything of that sort, thank you.
So as we get started today, we want to just share a little bit about, the Long-Term Care Equality Index and why this is important to the lesbian, gay, bisexual, transgender, and queer communities. So the Long-Term Care Equality Index, or LEI, is a joint program of SAGE and the Human Rights Campaign Foundation. As partners in this work, we have been planning for this project for several years, and we are so excited to really, start to launch the LEI and see this become a reality. The LEI will promote best practices in creating welcoming and supportive long-term care communities inclusive of LGBTQ community members across the nation. During our time together today, we're going to provide you with a better understanding of LGBTQ older people and their unique needs. We'll understand the LEI and its purpose. And we're also going to learn about the next steps your community can take towards becoming more LGBTQ inclusive. There's a common thought across the country that LGBTQ people only live in large cities like San Francisco, New York, and Chicago. Yet today, we know that this growing population of some 3 million LGBTQ people aged 50 and older live in communities large and small across the country. And we see even greater than expected numbers of folks who are residing in rural communities. And even with the progress that we've seen for LGBT equity, LGBT older adults often remain invisible to the broader community, in large part due to a history of stigma and discrimination. It's not uncommon for long-term care communities to assume that they're not serving LGBTQ older people or LGBTQ caregivers. This is often due to a reluctance of LGBTQ people to come out and to share their true selves and identities within the health and human services industry. The LEI is here to help support communities like yours who are ready to embrace LGBTQ inclusion, which in turn strengthens your commitment to person-centered supports for all residents, including those who identify as LGBTQ. Next slide, Dan. So what are some of the unique needs regarding LGBTQ older adults? Due to a number of these needs, we know that LGBTQ older people may have an increased need for long-term care services and supports as they age. These needs include having smaller social networks, being less likely to have children, or less likely to be partnered, and more likely to develop chronic illnesses as they age. All of these factors increase the need for LGBTQ community members to work closely with the long-term care community to help ensure that LGBTQ older people have access to quality supports and services that meet their needs as they age. But I don't want you to take my word for it. I'd really like for us to take a few minutes and hear from LGBTQ older adults talking about why the LEI is important to them.
If you don't think you have lesbian,
gay,
bisexual, and transgender people in your long-term care community, think again.
Upward of 5% of your residents are members of the LGBTQ community.
we are living in your communities and may stay silent or in the closet.
Because we are afraid of discrimination.
That's not surprising since many of us have lived for decades under legal discrimination. Discrimination that persists today.
There are over 2.5 million LGBTQ people over the age of 50 living in America today.
Experts predict that by the year 2030,
close to 7 million LGBTQ elders will be seeking care and services.
That's why it's more important than ever that long-term care communities like yours support us as we age.
and treat us with dignity and respect so that we won't be forced to go back into the closet.
And it is often more difficult for Black and Latinx members of our community.
Fear of inadequate care and discrimination are compounded by racism.
Across the country, LGBTQ elders are not getting the care and support we need to thrive.
Let's change that.
The Human Rights Campaign Foundation and SAGE believe
that most long-term care communities want LGBTQ elders to feel welcome and get the care they need.
And deserve.
And that's why the LEI exists.
The LEI helps long-term care communities adopt better policies so that they can provide culturally competent and responsive care to LGBTQ elders.
with your help, we can change the future.
Let's make sure that long-term care communities are welcoming and inclusive to LGBTQ elders like me.
And me.
And me.
And me.
And me.
Sign up for the Long-Term Care Equality Index today.
You're muted.
There we go. Hello. I truly love that video because it really comes from the perspective of the older individual themselves. When we talk about culture change, when we talk about this unique opportunity that we have to best direct care for meeting the needs of individuals, of residents, regardless of how they identify, we truly create a greater care environment and community. The Long-Term Care Equality Index, which was announced and launched in March of 2019 at the American Society of Aging Conference, is a national initiative between SAGE, bringing their expertise of LGBTQ aging, and HRC Foundation, where we bring our expertise in terms of policies and procedures. This national initiative is unlike any that has existed before. For those of us who have identify as LGBTQ, for those of us who have done this work related to LGBTQ aging, addressing the needs of long-term care and truly addressing the fear of long-term care is crucial. As Sherrill spoke to, this is a growing population that unfortunately, because of societal barriers, systematic discrimination, as well as isolation, often are in need of caregivers and those that are providing care within the long-term care service industry. While long-term care services and support spans a wide variety of resources, for purposes of the Long-Term Care Equality Index, we have focused in specifically on residential long-term care. This includes a wide range of care from skilled nursing, assisted living, independent living, senior housing, as well as residential care communities that span the gamut with continuum care, retirement communities, and the like. We even have space for standalone hospice agencies and homes. While we focus specifically on that residential long-term care, again, with the lack of caregivers and support, this is a community that unfortunately does experience a high level of chronic illness and disease that often has to rely on others for care. But how do we support long-term care communities to ensure that they're providing the best care that they can by having the tools, the support, as well as the policies and procedures to ensure that that care is sustainable across the lifespan of an individual in a community? The Healthcare Equality Index is what we base this Long-Term Care Equality Index on. The Healthcare Equality Index was developed by HRC Foundation in the mid-2000s, working with hospital systems across the United States. From its early implementation of having dozens and dozens of hospital facilities participating to now in 2020, having over 780 hospital facilities participating and ensuring that their individual facilities are meeting the policies and procedures that are inclusive for this community. So we wish to bring this to the long-term care industry as well. Now, what makes this initiative very unique is that not only are we bringing in the perspective of LGBTQ equality and those voices of SAGE, of HRC Foundation, of members of the LGBTQ community, we've also included a wide variety of voices from the long-term care field, aging and service providers, as well as older adults themselves. Thankfully, this initiative has been supported by large number of organizations that many of us have interacted with: AARP Foundation, Leading Age, American College of Healthcare Administrators, National Consumer Voice for Quality Long-Term Care, and again, Pioneer Network, that really see the value in supporting our LGBT elders and this initiative to support communities and ensuring that they can reach those measures as well. The framework that we look in and come with the Long-Term Care Equality Index is really trying to look at a wraparound level of inclusive policies, not just for residents, but for employees as well. We first start with our foundational practices in which we wish to ensure that as soon as an older LGBT adult walks through the door, as soon as an LGBTQ employee walks through the door, they have protections within their home and within their workplace. Unfortunately, we are still across the United States where over half of our states currently have no protections when it comes to housing, when it comes to employment, when it comes to public accommodations. Meaning in a variety of states, an LGBTQ elder could go seek care that they desperately need and be turned away at the door legally. Because of that, a lot of long-term care communities see the need and diversity with their communities and want to provide the best support that they can in terms of ensuring that LGBT residents understand that they are welcomed and affirmed. This looks at inclusive non-discrimination policy that does state sexual orientation, that does state gender identity. Moving on to ensuring that residents are supported, especially a strong focus on transgender residents in terms of their ability to be themselves and as well as express their gender identity. Ensuring that individuals have access to the LGBTQ community, both on a business end, how do we market to that population, as well as how do older adults themselves be able to access an inclusive care, an understanding of what that inclusive care looks like and what they can ask their community to provide. And again, and a focus on employees as well. When we know that individuals can bring their best self and their full self to a work environment, we can also see a greater commitment to that care that they're providing as well as within their job. Now, we've spoken a little bit about the benefits that organizations can see and experience while undergoing the LEI. While this is an initiative to ultimately lead to a large list of communities that have provided and have made this commitment to LGBTQ inclusive care, ultimately, it is a mutual beneficial relationship where not only are we providing residents an opportunity to find a community that suits their needs, but for long-term care providers to ensure that they're providing a welcoming environment for all diverse elders, being able to be seen on a national scale, as well as promoted on a national scale of their commitment to long-term care, as well as inclusive long-term care, having access to resources in which Sherrill will touch on a little later in our presentation, and truly provide an opportunity for a long-term care community to meet state, federal regulations, as well as that basis of providing the best quality care that one can. And so what are those steps that are involved? So we launched in March of 2019, and currently where we stand is we're providing organizations and inviting them to take a commitment to caring pledge. We'll go a little bit into the details of accessing our website to do so, where you can find on the lei.org a link to sign this commitment to caring pledge. But this initially is the first step for a community to say, yes, we are dedicated to ensuring that LGBTQ individuals are welcome to our community, are welcome to work there, are welcome to live there, and best support them, and that we are going to take the steps necessary. After doing that commitment to caring pledge, we anticipate in early summer a release of a self-assessment. Now, the self-assessment is an opportunity for communities to get a litmus test of where they are in terms of policies and procedures. Do we have that non-discrimination act that's inclusive? Do we have an intake form that asks about spouse and partner over husband or wife? These steps that we take build as well as better understanding of where we are in the self-assessment so that SAGE, individuals within the LGBT community organizations, HRC Foundation, can best support you in ensuring that you can meet those needs and qualifications of the policies that we're speaking about. Now, the self-assessment piece is really an educational tool for communities to better understand what next steps are possible and that they can take. And as we know, this is a multi-step process. We are currently in the midst of a pandemic. And again, we thank you all for taking the time to be here and see the work that can be done in terms of inclusivity. Lastly, once taking that self-assessment, once a community feels comfortable, we'll be releasing the final LEI survey in early fall that will culminate ultimately in a published report in May 2021. Here we'll highlight some of the organizations that have participated and signed this commitment to care, as well as down the line be able to provide a comprehensive index of long-term care communities across the United States that have made this commitment, that have taken steps and have met at the least our foundational policies. Now, I've been speaking about these foundational policies, mentioned an Inclusive Non-Discrimination Act, but I just wanted to take a moment and show you what this actually looks like in practice. One of our committee members of our National Advisory Council from the Abramson Senior Care Center has been at the forefront. They've been working on LGBTQ equality initiatives for about the past 5 years. In that process, they've created an inclusive non-discrimination policy in which it does state and enumerate does not discriminate on the basis of race, color, national origin, religious creed, disability, age, gender, gender identity, sexual orientation, or genetic information. Now, for a state like Pennsylvania, where there are LGBTQ protective and inclusive policies on a statewide level, one may think that we may not have to put this and show this to the general public. However, when we look and support older LGBT adults to find inclusive care, often that first step is checking the website and ensuring that an individual understands that they are welcome, prominently placing this information so that individuals can easily access it and recognize that this is a community that I'm welcome in. As we've seen the progression of LGBT equality over a short lifetime, we are still in a space where many of our older LGBT adults have experienced discrimination in healthcare and often had their identities pathologized. So there is a necessary added step that we can take as healthcare professionals, as social service professionals, to ensure that that's communicated. But you're not alone in learning how and what the best practices are. Thankfully, we do have some resources, and numerous resources are being built every day to ensure that you can reach these goals. And I'll pass it on to Sherrill, but we may need to have the mic unmuted. Joan.
There we go. Thank you, Joan. And thank you, Dan, for that explanation. We are going to have time for some Q&A here at the end today. So if you have questions around anything that Dan and I have presented, please feel free to start thinking about those questions at this time. As Dan said, the website for the LEI, which is thelei.org, has a number of resources already available to assist you as you start thinking about becoming a part of the LEI and taking our Commitment to Caring campaign pledge. One of the first documents is a fact sheet called Why the Long-Term Care Equality Index. And it was really designed as a two-page primer that you can easily print off and share with your boards of directors and other leadership folks in your community. That really helps to explain, why the LEI is important and why it's timely that more long-term care communities get involved with this work. Another resource, which actually we just completed, I believe in February, is the LGBTQ Aging, the Case for Inclusive Long-Term Care Communities. This is also available for download. It's a more in-depth brief on the importance of the LEI, and we actually highlight some of the long-term care communities who are doing incredible work already to support and include LGBTQ older adults in their communities. And so we invite you to download that document as well and take a look, as it will help to start really frame the importance of why you would want to do this work in your community. And then another document that we have available is a best practice resource guide called Inclusive Services for LGBT Older Adults, a practical guide to creating welcoming agencies. Again, this guide is available for download. It's a pretty easy read, and it really provides step-by-step, tips that you can implement today in your organization to help make sure that you're being as inclusive as possible as you move forward in this work. And so again, you can find those documents on our website at thelei.org. And I'd like to share another resource with you. This is a program that SAGE started in response to COVID-19 called SAGE Connect. And it's a phone support program designed to match LGBTQ older people with volunteer callers for a weekly check-in. And this is really designed to help reduce isolation that so many of our older adults may be experiencing today. We know that many of you are serving LGBTQ older adults today in your communities, and we know that they may lack a strong social and family support network. And so we want to be able to be a part of that network for them. So we invite you to share this information with residents who may identify as LGBTQ. You can encourage them to register and be a part of this program at our website, sageusa.org/SageConnect. So again, please feel free to share that with residents or LGBT employees that you have as well. And I will now turn it back over to Dan. I think, Joan, we're going to have to unmute Dan again.
Thank you, Sherrill, for that. What we want to emphasize and recognize is that this is new. This is new territory. Recognizing the diversity of our elders, the rising baby boomers that will be entering long-term care, that have been out and proud, the Stonewall generation. We know that this takes time. And that time starts with that commitment. And I'd like to share with you some words of wisdom, and you might recognize someone in this upcoming video, of what are other aging service providers saying.
Can you imagine being out from Can you imagine being out from age 20 to age 60, and now you're facing going into a long-term care facility, and you don't know whether the people will treat you kindly, whether the people will relate to you. You have no idea. The LEI is being created by SAGE and HRC is a wonderful first start.
It's a tool so that members of the LGBT community can find providers as they're aging to help meet their needs.
I think it should just be law and standard for all nursing homes, that we treat everybody equally.
We hear stories all over the country from older adults who've experienced adverse differential treatment. And it's important for us to really turn those stories into positive experiences for them.
I didn't think I would live to see this moment where something like the LEI would be created. It is extraordinary. Here we are, changing the world.
You're already serving LGBTQ individuals.
It is going to be a place where their identity will be recognized and to take one less worry off the plate.
We're all human.
I find it hard to imagine that there isn't a LGBT person in any nursing home anywhere in the United States. It's just hard for me to imagine.
Join me in being a part of the Long-Term Care Quality Index. Get started by signing the Commitment to Caring pledge today.
We didn't know that Joan moonlighted as an actress. But again, thank you all for, let me get back to the PowerPoint, that'd be helpful. There you go. Again, thank you all for taking the time today, ensuring that we can take these steps together, that all LGBTQ individuals can receive the care
Last year, SAGE embarked on 2
deserve, as well as all residents and all individuals as well. Again, we'd like to thank all of those that have signed the Commitment to Caring pledge. For those who have not, you can find that on the LEI.org. As stated, I also wanted to provide our email addresses. If you have any ongoing questions, need for resources, how can we take these first steps, please feel free to reach out to Sherrill or myself. This really is a process working towards equality and inclusivity together, and truly grateful to have this time with you. We have about 10 minutes left for questions, answers, things of that sort. So we just wanted to ensure that we could provide our time here as a resource. So I don't know if we have any Q&A at the moment, or.
The Q&As are kind of caught up, but let's see, we got a couple comments here. Stephanie made a comment. This is a scary feeling that I worry about personally. I appreciate the LEI, so thank you. We're all in this together. Thank you for being here. That was Cheryl's response, I see. And then JJ put a comment in, SAGE training was one of the best things that Sherrill House, I hope I'm saying that right, has done on our culture change journey. Our staff was amazed and eyes were opened in a great way. This is important work. Kudos for Pioneer Network for this partnership. And so you're welcome to either put additional questions or comments in the chat, or if you'd like to raise your hand, if you're feeling brave, if you want to raise your hand, you can actually talk to us. So I'll watch for any hands to go up.
I'd like to address the comments first. Stephanie, thank you for your vulnerability in sharing that. As a transgender man myself, as a gerontologist, thinking about my own aging trajectory down the line, recognizing what about my care? Will I be recognized and seen as Dan? Will I be able to have access to my gender affirming healthcare? And this is a reality that a lot of our LGBT elders are experiencing right now. So I appreciate the thanks, and it really is an honor to be able to do this work for my LGBTQ elders and for those of us as we go across the aging process. I would like to ask Sherrill if she would speak a little bit about the training that KJ mentioned in terms of the SAGE care training that you all provide.
Yeah, thank you, Dan, and thank you, KJ, for for your participation, for your organization's participation with the SAGE Care training. So we are working closely with SAGE Care to develop training that will be available to participants in the LEI. We also have an executive briefing that is going to be available to all the groups that are taking the LEI. And, folks will also be able to use other training partners. It doesn't necessarily have to be SAGE Care. Of course, we do welcome you to, work with SAGE Care in your cultural competency training. And as we continue to roll out the LEI and the requirements, you'll see more about the training and credentialing program that's available through SAGE Care.
And I was going to say, Stephanie has raised her hand, so
okay.
I'm going to unmute you, Stephanie, so you can share your thoughts. Stephanie, you may need to unmute on your end.
I got it. Can you hear me?
Yes.
Oh, good. Good. Thanks for unmuting me. And again, thank you both for this presentation. And I have signed on to take the pledge.
Wonderful. Thank you.
I also was wondering, because I sometimes co-facilitate PFLAG meetings, being lesbian myself. And I have always wanted to give back as much as I can, because I understand the fear and I understand some of the challenges that happen. And I also work with a nonprofit in long-term care. And so I just see how important this is, and for you all standing up to do this is just incredible, and I love it. Have you ever thought about collaborating with PFLAG as another form of outreach? Oh, Parents and Friends of Lesbians.
Yeah. Okay. Yeah, Stephanie, thank you for that question. SAGE has actually, looked at partnerships with PFLAG over the years. I think it's always a challenge to start new programs like this and to really make them take off. But I do think there's amazing opportunity to think about, bringing a PFLAG type support, work into long-term care communities. And that's something that I've often envisioned, because so many PFLAG chapter sponsors are actually living in long-term care communities today. So I think there's some great potential to think about inclusive programming that, supports residents. We did a program with a PFLAG chapter locally here in St. Louis, Missouri, where I live, and it was called Grandma, Grandpa, I'm Gay. And it was designed to introduce, heterosexual cisgender grandparents to, a greader understanding of their LGBT grandchildren. So I think there is great opportunity for partnerships there, Stephanie.
Oh, how interesting. Wow, that's great. That's wonderful. I work, you know, I don't work, I'm just volunteering on a sort of a local level. So I don't know anything from a national standpoint, but it's just something that I was thinking about watching your presentation. So that's great.
Thank you for that.
Thank you, Stephanie. And I think you bring up an excellent point for those of you that are viewing this and are not in the long-term care field or not in aging services field. Really, we need help getting the word out. We're a small but mighty team working on this LEI initiative and wish to provide options for individuals that are in San Francisco, that are in Chicago, but that are located in smaller communities, rural communities. As Sherrill stated, we have a higher percentage of LGBTQ people in rural communities, and there is excellent work being done already. However, how do we ensure that these communities know about the LEI, how they can participate so that their inclusivity can be shown across the US? I see we have a message in terms of sharing some other communities that have been seen as leaders in caring for LGBTQ nursing home residents. We have highlights and spotlights of professionals that Sherrill can speak to in some of our resources that give an insight of some of these communities that are taking these best practices to heart.
Yeah, thank you for that, Dan. And I see that we have another comment here from Stephen. And, you know, Stephen shares that there was a concern in a community that he worked in dealing with a gentleman who had, as he says, innocently put his hand on the back of another resident, and this was potentially seen as harassment, it sounds like. And, you know, I think this story that Stephen shares with us is another example of why this work is so critically important. You know, without LGBT inclusive policies, LGBTQ residents continue to be at risk for discrimination and stigma, you know, from executive team members who may, you know, not be supportive of LGBTQ residents. And oftentimes, you know, that can lead to a situation where, you know, an LGBTQ resident really doesn't have recourse. They may not be able to, you know, respond to an allegation in the way that a non-LGBTQ resident would be able to. So, you know, thank you, Stephen, for sharing this story. And again, it's why it's so important that we, you know, find more communities that are stepping up and want to be inclusive of LGBTQ older adults.
And I was just going to add the question about sharing resources. I was privileged enough to represent Pioneer Network as a member of the LEI Advisory Council. And one of the things that is, to me, such a wonderful piece about the work of the LEI is it's not just an assessment to see where you are, but it's an initiative to help people find a way to do better. So instead of just saying you have to do better, you have to have better policies, you have to have better practices, they are sharing examples of what those policies look like, what those initiatives look like in communities who have really embraced the LGBTQ community and are truly leaders in this. So you don't have to figure it all out on your own. They have pulled together, Sherrill and Dan and so much of the leadership of this team have really brought together some wonderful resources. And that's part of what I see this entire initiative to be, not just to tell you what to do, but help you figure out how to do it.
Exactly. Thank you, Joan, for stating that. In addition, I'm remiss to not share this. In addition to the self-assessment being released, we'll also be releasing a best practice resource guide so that with every question that's being asked on that self-assessment, you'll receive an understanding of why we're asking that, as well as actual resources and examples from other communities in the field. This is an initiative that truly we want to make hand in hand with those in the long-term care field, those that are experiencing and accessing long-term care. And by doing that, there's plenty of support along the way. You know, this is a greater initiative, as Joan stated, to providing care the best that we can, and in this particular case, LGBTQ elders. So we'll be sending out information. You'll be seeing something through Pioneer Network when that is released, as well as a link to that best practice resource guide. And it's a useful tool for individuals, even if they aren't taking the self-assessment at this particular point in time.
Wonderful. Well, Sherrill and Dan, do you have any other comments, or do we have any questions? And Dan, I don't know if I'm the only one that lost it, but I lost your slide.
You are not the only one. My computer decided it was done with the slides, but I will get it back up.
I love technology. Isn't it a wonderful thing?
It is.
Well, if there are no other questions, there have been some great questions, great comments. Dan and Sherrill, this is such wonderful information that you are sharing and such wonderful work that you are doing. I can't get more person-centered than this. And so on behalf of Pioneer Network, we're very proud to be standing here beside you in this work. So I'll just give you a little bit of a commercial now as we move on. You know, in these challenging times, resources are critical, just as we've just talked about. And so we're very proud at Pioneer Network. One of the things we have been doing this last month and a half, I can't believe it's been that long, is putting together a group of resources for combating isolation, which certainly is impacting our elders. It's impacting all of us, I think, right now. These are wonderful free resources that people have generously contributed. So I invite you to take a look, see what they are. They're always changing. We're always finding something new to put on there. And I'll go ahead, if it's okay with Sherrill, I'm going to put the Sage Connect up there, because what a great resource that is that we're now just learning about. So a little bit of then follow up from the webinar. As I said, when you close out of the webinar, you will get a survey opening up in your browser, and please, we encourage you to take a look at that and give us some feedback, because this is not the first time Sherrill and Dan, well, this isn't the first time Sherrill and Dan are here talking with us, but it's not going to be the last. So we want to make sure that we're addressing things as you would like them to be addressed, and get all your information. And then in about 24 hours, you will receive a recording to this, as well as probably early next week, this will be available on our website. So the next slide, I just want to mention that in May, our webinar is Growing Person-Centeredness, is in our Growing Person-Centeredness series, and it's Empathy, the Key to Dementia-Inclusive Communities. And this is being presented by some of our partners from Ontario, who are doing some phenomenal work in this area, and Mary Beth Witten, who happens to be an elder living with dementia, who shares her insight, and then Penny Cook, our president and CEO, who will kind of help tie this together for everyone. So we would invite you to take a look and see if that's an opportunity you'd like to participate in. And then the last slide here is, normally at this point, as Dan shows this slide, I would be sharing with you an invitation to join us in Pittsburgh in August for our annual conference. But as we all know, nothing is normal these days. So instead, I just want to share with you that Pioneer Network is continuing to watch the current situation, explore options for supporting an annual gathering of pioneers for learning and networking. And we don't know whether it's going to be live or virtual or a combination of both, but we're doing a lot of work behind the scenes trying to figure out just what that might be. But we certainly are committed to do something to bring the pioneers together and continue that networking. So keep an eye on the Pioneer Network newsletter or the Pioneer Network social media pages. And just as a little blatant plug here, if you're not currently getting the Pioneer Network newsletter, just go to our website, www.pioneernetwork.net, and you can sign up. So that's all I have. I'd just like to once again, on behalf of Pioneer Network, thank you again to Dan and Sherrill, to everyone on the LEI team that has done such incredible work, to all of you for giving of your time, very valuable, especially these days, and please stay safe.
Thank you, Joan.